Rime is a simple tool that you can use to assess the proficiency of your student or learner. Try using it to help the learner move to the next stage of proficiency. So, you just saw Mr. Bradford. Do you want to tell me a bit about him?
Sure thing. So Mr. Bradford is a 36-year-old man. He has past medical history only of having his tonsils out when he was 14, and he's taking some vitamins for medication. He says that he's had a flu-like illness for about 4 days, and he presents today with right-sided chest pain. He describes the pain as sharp and that it started quite suddenly. He said that it's worse when he breathes in, but it doesn't change with any positions that he gets into. And he also says that he's a bit short of breath. So his review of systems, he says that he has no headache, no abdominal pain or any weakness. He did have a bit of a cough for a couple days. He's had some diarrhea, but no urinary symptoms. And he says that the cough has been productive. On physical exam, he had a temp of 38.3 and a pulse rate of 105. I did think I heard something in the right base when I listened, but he has a benign abdomen and a normal MSK and neuro exam.
So, you just saw Mr. Bradford. Why don't you tell me a little bit about him?
Sure thing. So Mr. Bradford is a 36-year-old male. He's previously healthy. He comes in with a 4-day history of sort of flu-like symptoms, and today he's particularly complaining of some right-sided chest pain. So he describes the pain as being quite sharp. It came on quite suddenly, and he says it's worse on inspiration, but there's no change with position. It sounds quite pleuritic. He also says that he's had some shortness of breath. His review of systems is positive for a cough. He's had a cough for about 3 days. It is productive, but he reports no blood at all. So, and he does say that he's had some diarrhea, but no urinary symptoms. In physical exam, his temperature is 38.3. He has a pulse rate of about 105. His abdomen is benign, and his MSK and neuro exam are normal. On resp exam, however, there's a bit of a problem in the right lung. I felt at the bases it was a little bit dull to percussion, and I also heard some crackles. So in summary, I think because he had sort of this pleuritic type chest pain, as well as some dyspnea and the fever, I think the most likely diagnosis is probably a pneumonia.
Right. So you've been seeing Mr. Bradford. Do you want to fill me in on what's been happening?
Sure thing. So Mr. Bradford is a 36-year-old previously healthy male. He's had about a 4-day history of flu-like symptoms. He comes in today with pleuritic type right-sided chest pain. The only relevant thing on his systems review is that he's had a productive cough for a couple days, but no hemoptysis. On exam, he's febrile, 38.3, and he does have signs suggestive of a consolidation in his right lower lobe, which we confirmed with X-ray. So in summary, this previously healthy man has community-acquired pneumonia, and my plans for him would be to order some basic labs, so CBC diff, electrolytes, and blood cultures, and start him on some antibiotics for the pneumonia.
Sounds great. So, looks like you were looking after Mr. Bradford last night. Tell me what's been going on with him.
So Mr. Bradford is a 36-year-old previously healthy male. He came in last night with a community-acquired pneumonia. The chest x-ray did show a right lower lobe consolidation, and he did have a white count of 18,000. So we started him on cefotaxime and azithromycin, and we're waiting for his blood cultures in the meantime. I'm wondering whether we possibly could have started him on oral antibiotics, but I think I'll look it up this afternoon, the actual guidelines for treating a community-acquired pneumonia.
Yeah, that might be helpful.